Tell me when it stops. Okay, go ahead and tell me what's going on with you. Okay. And when did it start? Okay, so the last time you were here, we weren't really able to tell what you were having. Okay. And any new symptoms since then? And how persistent is that? Okay, so it's pretty constant. Have you been taking any new medicine? Okay. Alright. Yeah, it seems that we do need a little bit more information. Any signs of blurry vision, double vision, anything like that? Okay. And have you noticed any problems with your speech? Okay. Any sensory problems? No. Okay. Okay. We can go ahead and start your checkup. I'm going to ask you to cover one eye. Perfect. And I do have here a Snellen chart. So I'm going to ask you to go ahead and extend your other arm all the way. Perfect. And that's kind of the length that we want. So go ahead and relax. I can hold the Snellen chart for you. Good. And can you please tell me what number you see right here? Okay. And what number do you see here? It's kind of hard to tell. Okay. Go ahead and tell me the number after. Okay. And what number do you see here? Alright. Alright, can you please try and read this row starting with the first letter to the left? Okay. And now can you try and read this row starting with the first letter from the right? Okay. Can you tell me what color you see here? Alright, in here. Okay. Let's go ahead and switch eyes. Okay. So that's again perfect length. Go ahead and tell me if you see the same color that you saw with your other eye. What about now? Okay. Go ahead and read this row starting with the first letter from the right. Okay. Can you tell me what number you see right here? And here? Okay. Very good. Go ahead and look straight at my nose. I'm going to flash a light in your eyes. It's going to be a little bit uncomfortable. Sorry about that. So we're checking pupil dilation and constriction, also to see if there is any asymmetry in between them. That could definitely be triggered by a neurological disorder. Alright, go ahead and look right here for me. Okay, and now look here. I do see a little bit of shakiness. Can you follow the light with your eyes only? Don't move your head. Are you experiencing any pain when you move your eyes from side to side? Okay. All right. Can you please tell me how many fingers do you see? Okay. What about now? All right. Go ahead and look at my fingers right here. Look at my fingers right here. Okay. Look here. Okay. Look here. All right. Look here. Okay. All right. So every time I do this with my fingers, I'm gonna need you to blink, okay? Blink. 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 Alright, so keep on looking here at my two fingers. And whenever I do this with my fingers, I need you to blink your eyes. Blink. 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 Okay, now look here. Blink. 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 Okay, go ahead and look right here. And every time I do this with my fingers, I'm gonna need you to look to the right, okay? So switch your vision from the fingers, looking to the right. Okay, so keep on looking here. Good. 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 Okay, we'll do that again. Okay, now I need you to shift your vision to the left, okay? So go ahead and look right here for me. Right here. To the left. 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 And again, look right here. I'm gonna look a little bit farther now. Look to the left. Okay. Okay. Good. Okay. I'm going to further check your vision. So I have here some numbers. I'm gonna start with the one that you can definitely read. Go ahead and tell me what number you see right here. Good. And below it. Okay. What about now? Okay. So it's definitely getting harder for you to see those numbers, which is definitely expected. That's not a reason to worry. Okay, have you noticed any flu-like symptoms? A little bit of body aches. Go ahead and take your we're gonna go ahead and take your temperature. I'll put this under your tongue. Can you please go ahead and purse your lips around it and have the tip of the thermometer right under your tongue? Okay, good. we're going to go ahead and listen to your heart now. I usually wait a little bit until we already start the examination to check and listen to the heart rhythm. Sometimes patients can be very anxious, so I want to make sure that they're very relaxed. I'm going to put this under your shirt. Is that okay? Okay. So we're just going to go ahead and slide this. Good. Okay. And just breathe normal for me, please. I can hear only S1 and S2, no S3, no S4. It's only lub dub, 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 lub dub. Okay, I'm going to go ahead and switch. We're going to listen with the bell now. And we're listening for any murmurs, something that would indicate an aortic regurgitation. Okay, I could not hear anything abnormal. Let's go ahead and check your lungs. Can you please take a deep breath in and breathe out? Okay, and again, take a deep breath in and breathe out. Good, and again, take a deep breath in and breathe out. And I'm going to listen to the sides as well. Go ahead and lift your arms a little bit. Thank you. Take a deep breath in. Good. And breathe out. Good. And we'll do the same thing on the left side. Take a deep breath in. And breathe out. Okay. Very good. How is your blood pressure lately? Do you get upset a lot? Yeah. I know how this is. So, I'm going to check your blood pressure. Do you have an arm preference or any conditions that would not allow me to use a specific arm? Okay, then I'm going to go ahead and use your right arm. Okay. Good, so we're just going to go ahead and give your arm a big squeeze with a cuff. This should not hurt. It's just going to be a little bit tight. Okay. Okay, so just relax for me, please. Alright. That was kind of tight, I know. Okay, blood pressure is also normal. Were you concerned at all that it would be kind of high? Okay. Do you feel any kind of pressure around your head? Okay. I'm going to go ahead and take off the cuff, so just slide this down. Okay. Very good. Right. Going to go ahead and put some gloves on. Okay, and are you experiencing any headache right now? On a scale of 0 to 10, how would you rate your pain? Okay, I'm going to start with a gentle physical exam. I'm going to go ahead and just palpate your head. If you feel any kind of pain, just let me know, okay? Very good. Okay. I do feel kind of a bump here. Do you remember? Do you recall falling, hitting your head? And do you have any pain? So that's normal. That just means that you did bump your head. I'm very curious if you are sleepwalking, since you can't remember. It's kind of round, so it's definitely a hematoma. A hematoma is an aggregation of blood cells to the surface of the skin, kind of. And that's kind of how it feels. I would apply some ice on it, and if it doesn't go away within 3 to 5 days, I would say come back, but I wouldn't be worried. Alright, I'm going to go ahead and check your sinuses. Can you please look right here straight? Any pain there? Any pain here? Okay, I'm going to palpate above your eyes. Okay, and have you noticed anything swollen around the neck area? I see. So let's go ahead and check that. What about here? Any pain? Okay. Now we're checking for any lymphadenopathy, which may be indicated by a swollen lymph node. Sometimes that can happen when we're fighting some viruses, so nothing that we want to jump to any rapid conclusions. Okay. I'm going to check your segmental lymph nodes. They're right under your chin. Okay. Can you go ahead and open your mouth for me? Good. Say ah. Ah. Very good. Can you stick your tongue out a little bit more? I'm trying to see behind, in the back of the throat. No swollen ganglions. Okay, very good. And can you please try to push this blade with your tongue? Good. And again, try to push on the other side now. Good. Okay. Can you give me a big smile? Excellent. So that was very symmetric and appropriate, which is normal. Now go ahead and frown. Puff your cheeks. Keep them puffed for me. Don't let me unpuff them. Very good. Go ahead and try to push with your tongue inside your cheek. Okay. And the other one. Okay, very good. Now go ahead and look right here. Good. Now look right here. Excellent. Can you tell me when you don't see my fingers in your field of vision? Okay. And again. Tell me when you see them. Okay. Okay. I'm going to ask you to look this way for me. I'm going to check your ears now. I'm looking for any redness or any signs of infection. And there seems to be some redness in your right ear. Let's go ahead and check left side. Definitely some redness here as well. Okay. Now, since the ears are definitely related to the olfactory nerve, let's go ahead and check your smell. I do have here a few smell tests. This one is very good. Go ahead and breathe in through your nose and out through your mouth. Good. And one more time. Breathe in through your nose and out through your mouth. What does that smell like? Coffee. Okay. Perfect. So since you are having some issues, I do want to get a swab from you. So let's see what we have here. Okay. Are you very ticklish? Alright. Well, this is going to go right inside your mouth, around the cheek. So we're just going to do a very gentle swab here. Okay. How did that feel? Good. Okay, and then we're going to add an acidic solution to this. Perfect, and we're going to send this to the lab. I'm going to call you back with the results, okay? Perfect. Now, let's go ahead and check your vibrations and how you perceive sound. I'm going to make a vibration sound. Go ahead and tell me when you don't hear this sound anymore, okay? Now. Right, let's go ahead and try that again. Go ahead and tell me when you don't hear it anymore. Now, good. Let's go go ahead and do that again. Now, good. What about now? Tell me when it stops. Good. Can you tell me on which side of your ear you hear this? Left or right? What about now? Left or right? And now? Okay. Okay. It does seem like we definitely need to do more tests. Have you noticed any skin disorders? Any eczema? Any dryness? Okay. And are you following a certain diet? Are you vegetarian or vegan? Okay, we can definitely substitute and have you take more vitamin B12. That's going to help. Yes. And are you taking any vitamin D? Right. Very good. So you're taking vitamin D. We're going to go ahead and prescribe vitamin B12. Also, are you taking anything for stress? I did notice that you're having some anxiety, so we're going to go ahead and help you out with that. All right. So we're going to try a new supplement. It has ashwagandha and other elements that scientifically can help with anxiety and stress reduction. Would you be interested? Okay. Perfect. So we're gonna go ahead and prescribe you all of that. If you have any questions for me, go ahead and let me know. You can send me a text message or an email via portal, and I'm going to respond within 24 hours. Okay, very good. It was very nice to meet you. I'll see you back soon.